Hey everyone, and welcome to Visual Depicts Med. Here on the channel, our whole goal is to take these super complex medical topics and, well, make them click, using clear, dynamic animations. Today, we are diving deep inside the brain to explore its hidden internal plumbing, the ventricular system. Now, this isn't just some boring anatomy lesson. Think of it more like a dynamic river that's absolutely essential for brain health. But what happens when that river gets blocked? The consequences can be pretty severe. So, let's follow the flow.
So here's our game plan for today. We're going to start with the basics, the ventricles and the fluid inside, called CSF. Then we'll get into the really important stuff, the applied anatomy, and what happens when things go wrong, like in hydrocephalus. And of course, we'll wrap it all up with a quick review and a couple of questions to make sure it all sinks in.
All right, let's jump right in. The best way to think about the ventricular system is to imagine this network of interconnected lakes and rivers, but deep inside your brain. That's pretty much what it is, and that river flowing through it is the cerebrospinal fluid, or CSF for short.
Okay, check out this map of our legs. We've got these two big C-shaped ones called the lateral ventricles, and there's one in each half of your brain. They both connect to this single central one right on the midline, which we call the third ventricle. From there, it's a tight squeeze down a narrow channel, the cerebral aqueduct, which leads to our final stop, the fourth ventricle, nestled right between the brainstem and the cerebellum.
So what exactly are these things? Well, they're basically hollow spaces that formed way back when our brains were developing from a simple neural tube. The walls are lined with special cells, ependymal cells, that help keep the fluid moving. And of course, they are filled with that super important CSF. But where does all this fluid come from? It's constantly being made by a spongy, specialized tissue called the choroid plexus.
And when I say constantly, I mean it. This isn't just a slow trickle. The choroid plexus is a production powerhouse. We're talking 500 to 700 milliliters of new CSF every single day. To put that in perspective, that's enough to fill a large water bottle. This is so important because it means if there's a blockage somewhere, that pressure can build up, and fast.
Let's trace that entire journey, step by step. First, CSF is made in the choroid plexus. It then flows from those big lateral ventricles through a little doorway called the interventricular foramen of Monro and into the third ventricle. From there, it gets funneled down that narrow cerebral aqueduct of Sylvius and splashes into the fourth ventricle. Finally, it escapes through a few small openings, or apertures, into the subarachnoid space, this area that surrounds the whole brain and spinal cord, where it eventually gets reabsorbed back into your blood. What a trip!
Okay, so that's the normal flow. That's the what. Now let's get to the so what. Why is it so incredibly important to understand this system if you're going into medicine? Let's break down why this really matters.
This table really sums it up. We have 5 key points. 1, it's where CSF is made. 2, and this is the big one, a blockage here leads to a condition called hydrocephalus. 3, it can be a site for specific tumors, like ependymomas. 4, things can go wrong during development. And 5, it's a space where blood or pus can collect if you have head trauma or an infection. Now, all of these are important, but for today, we're really going to zero in on point number 2, because it's the most common problem you'll see.
Right. So what happens when a river of the mind gets dammed up? This is where we get into the condition called hydrocephalus, which literally translates to water on the brain.
The definition is actually pretty simple. If you get a blockage anywhere along that path we just traced, the fluid can't get out. But remember, the choroid plexus doesn't get the memo. It just keeps making more and more CSF. So the fluid backs up, just like a river behind a dam. This forces the ventricles upstream from the blockage to swell up or dilate, and that puts a ton of dangerous pressure on the brain tissue around them. Now, not all blockages are the same. The first type is called noncommunicating hydrocephalus. This is when the dam, so to speak, is inside the ventricular system itself. The classic example of this is a condition called congenital aqueductal stenosis. That's just a fancy way of saying that narrow channel, the cerebral aqueduct, is blocked from birth. Fluid gets trapped in the lateral and third ventricles, causing them to balloon out. But what if the blockage isn't actually inside the ventricles? What if the problem is further down the line, after the CSF has already left the system? Well, that brings us to a whole different category of hydrocephalus. This is what we call communicating hydrocephalus. In this case, the CSF can flow freely between the ventricles. They're still communicating with each other, see? The real problem is in the subarachnoid space, where the fluid is supposed to get reabsorbed.
A good example is after a patient has had meningitis. The inflammation can cause scarring and adhesions that basically clog up the drains, causing fluid to back up everywhere.
And there's a really specific and important type of communicating hydrocephalus you need to know about called normal pressure hydrocephalus, or NPH. Here, the arachnoid villi, those little structures that act like one-way valves to drain CSF back into the blood, they just stop working correctly. This can sometimes just happen, or it can be a result of head trauma or a brain bleed. And it shows up with a very classic set of symptoms.
And here is a mnemonic you absolutely have to remember for your exams. The NPH triad is wacky, wobbly, and wet. Wacky refers to cognitive decline or dementia that gets progressively worse. Wobbly is for an ataxic gait, meaning their walking is unsteady and they look like they might fall. And wet refers to urinary incontinence. If you see this triad in a patient, NPH should be at the top of your list.
Okay, let's talk about one last clinical condition, and this one has a very tricky name. Pseudotumor cerebri. That literally means false tumor of the brain.
And the name says it all, there is no tumor. What's really happening is an increased resistance to CSF outflow, which leads to really high pressure inside the skull. But here's the twist that makes it different from the hydrocephalus we just talked about. Instead of the ventricles swelling up, all that pressure can actually squeeze them, making them look compressed or slit-like on an MRI scan. And you'll most often see this condition in young, obese women.
Phew! Okay, we have covered a ton of ground, from the basic plumbing all the way to some pretty complex clinical stuff. So let's do a super quick recap, and then I'll hit you with a couple of questions to see what you've learned.
Here are the absolute essentials. First, know the flow of CSF. Second, remember that non-communicating means the block is inside the system, and communicating means it's outside. And third, please, please, please don't forget that NPH triad. Wacky, wobbly, and wet. Got it? Good.
All right, question number 1. If you have a blockage of the cerebral aqueduct, which of the ventricles are going to get bigger? Think about the direction of that CSF flow we talked about. What's upstream? I'll give you a second to think about it.
You got it. The blockage is between the third and fourth ventricles. So all that pressure is going to back up into the third ventricle and then into the lateral ventricles that feed into it. Perfect. And for our last question, what's the name of the condition that gives us that famous wacky, wobbly, and wet set of symptoms?
That's right. It's normal pressure hydrocephalus, or NPH. If you remembered that mnemonic, you'd get this one right every time. And that's a wrap. I really hope this guided tour of the ventricular system was helpful. At the end of the day, it all comes back to this. Understanding the anatomy is the absolute key to figuring out the pathology. If you found this useful, don't forget to like this video and subscribe to the channel. And definitely let us know in the comments what complex topic you want us to break down next here on Visual Depicts Med. See you next time.